The Embark treatment approach focuses on 6 key concepts: the developmental lens, the CASA developmental framework, an experiential approach, a systemic approach, the use of outcomes-driven treatment, and therapeutic relationships. Every person along the lifespan is in the process of development, and that's what allows us to be able to treat not only the client, but the parents and that entire system that they're a part of. Oftentimes there's a discrepancy between a chronological age, how old are they in years? The client might be 17, 18 years old, but when we ask parents how old are they emotionally and developmentally, oftentimes that's much younger. And so for us to have expectations that are based on a 17-year-old, but emotionally they're 10 or 12, that's a misalignment. Once we embrace where the client is at developmentally, then we can provide some accurate assessment in knowing what is best treatment. And the CASA framework is a roadmap for us to know how to provide secure attachment relationships. It stands for commitment, acceptance, security, and attunement. Attunement is looking past the immediacy of the behaviors and being able to tune with or harmonize, use some empathy to understand what's happening with the child. Oftentimes, children will throw temper tantrums, and instead of having a knee-jerk reaction to say, just knock it off, attunement goes deeper and really looks at, gosh, what is the history of the child? What's actually making up their emotional reactions to things? And that allows us to begin to co-regulate. You can think of regulation as there's regulators on engines that doesn't allow the overheating. It allows that engine to stay in a healthy, functioning way. It's a similar function as human beings experience through secure caregiving. Repetitive, reliable experiences of co-regulation is what facilitates healthy development. Then we start to layer on 3 main dynamics. The first one is experiential. Our development is hardwired in our DNA to learn and grow contextually. We need experiences. We need to be out in the world, engaging our senses to be able to learn and develop. Here at Embark, experiential therapy is about developing a capacity and a willingness to experience emotions. So oftentimes you'll hear experiential therapy being like canine therapy or equine therapy, but even individual therapy, spending time with somebody else, doing family therapy, all of those things are experiential. They're increasing our capacity, our willingness, and our safety to experience emotions. We know we need experiences, but within the context of systems. So family systems work in a way that how other people react and behave impact the way that we behave and feel. We want to be able to address the family system because we need to change what's called homeostasis. And homeostasis is just natural patterns that systems undergo to maintain some sort of stability. When clients come into treatment, they're oftentimes going back into the family system. And if the patterns of those family systems aren't changed, it's almost impossible to resist that gravitational momentum that that family system has. We have a tremendous amount of outcomes, and those outcomes give us objective measures to know, is this effective? Are we reducing the level of anxiety, the level of depression? What's unique about our Embark treatment approach is that we're gathering measures all throughout treatment, and those measures inform treatment. We'll continue to track post-treatment, 9 months, up to a year, up to 2 years out. So then we have reliable data to say, is this creating long-term effective change? All of these pieces provides us a very solid, reliable foundation to look at how we're creating healthy therapeutic change and, more importantly, therapeutic relationship. You can be an effective therapeutic person if you're the parent. Eventually, the client themselves can help others be restored and have healthy relationship. The Embark treatment approach has helped literally thousands of clients and families over the years, and we are so honored to be a part of the process so we can create joy and heal generations.